First and always, improve access to addiction prevention treatment. This is ground zero for dependency. If we don't get this right, then we're going to keep losing lives.
Absolutely.
So this wish list calls for more publicly funded treatment centers. I'm asking, please, this Easter Sunday, that somebody think about the families out there who cannot afford to carry their child to a rehab center. In any country, a state-run rehab center is very important. And Piparo was shut down, and we didn't know. No one got an explanation. There was no warning or anything like that. And to this date, we don't know. All I know, we had people line up to go there, and then next thing you know, it was shut down. So I would like that to be brought back on the front burner, please.
Absolutely.
And because you see, the rehab facilities we work with, of course, you have to pay them. And the three we recommend all the time: New Life Ministries, Rebirth House, and Serenity Place for women, and they all require funding. Or they all require the clients to pay, but there are some people who just cannot afford it. And let's look at it this way: a mother, a grandmother, never seen cocaine, marijuana, nothing in their life. In the time when they should be relaxing, now they have a member of the family terrorizing the home, because that's what happens when you have an addict in a home. He or she becomes a terrorist. I have seen burglar proof around fridge already, because the addict was just taking everything from the home. And by the time the person, if they admit they need help, the amount of money that they don't have that they spend, and then apart from what the addict steals from them. This is how we operate. So think about those families, and not just the worthless addict, the families who had nothing to do with drugs coming into the country or even selling it. They probably never seen it. They now have to bear the pain of having an addict in the home. I could tell you that is not a picnic.
Absolutely. And publicly funded treatment, as Garth is saying, it removes the financial barriers to recovery, making treatment accessible to everyone, regardless of who can and cannot afford it. So the affordability and the access is one point. The earlier people can intervene equals better outcomes. So when people can access treatment early, it means they're less likely to experience the severe consequences of their use. It reduces the pressure on hospitals and emergency services, because people can be redirected to appropriate care. It supports homeless, vulnerable populations like homeless persons, persons who have suffered trauma, persons who are unemployed. It saves money in the long run, because treating addiction early reduces cost on the state. And it destigmatizes treatment, because we know that a lot of people are still very ashamed when it comes to addiction. And when rehab is treated as a public good, like education or like healthcare, it reinforces the message that addiction is a health issue and not a personal failure.
So harm reduction strategies such as drug treatment in prison, a comprehensive drug treatment facility in our prison. We are too small of a country to have, addicts just running all over the place, especially, and they go to prison and there's that revolving door. I know in their own way now, Mr. Bruce and of course, the commissioner, they're trying to see how they can separate the sheep of the goat, because they have some people who would go in and speak to the addicts and all of that. Mm-hmm. But we had New Life Ministries running a proper drug treatment program in the prison, and we know what happened to that. So we hope this government,
the next
government, will look at it again and put New Life Ministries back. Let them start a fresh program and separate the sheep from the goats, so that at least, and this can be done and add with legal stuff added to it. I mean, if the person can go through the entire program, apart from if the crime committed actually requires them to do time, then this should be part of the bargaining chip for them, so that they would not have a conviction when they return to society. And once it's proven that there's a drug problem involved, right? So drug checking services, allowing users to test substances for harmful adulterants, like fentanyl. We know this is a
It might be a touchy one, but it
A-
is
a
something that is
stretch.
done in other countries, especially when you have these large festivals where you know the persons who are attending are using drugs. There are stations set up where you can bring your drugs to have them tested to ensure that what you know what you're taking, and the drugs that you're taking are not laced with more dangerous things like fentanyl.
Gambling awareness, responsible gambling messages, funding independent problem gambling support services.
Yes.
And Natasha, we could give you a further breakdown on that.
Yes, harm reduction is gambling awareness. We don't have enough of it. We have tried on our independency to do our part, but there is an Emmanuel community that exists, and if you are interested in reaching out to them, they provide peer support for problem gambling. Emmanuel community can be reached at 776.
No, sorry. That is well, the Gamblers Anonymous. That's 776-0417. And they have meetings in Santa Cruz. Just call the number and they'll tell you the location was Tuesdays at 6:30 p.m. And Emmanuel Community, they have their meeting on Fridays from 7 p.m. They are in Woodbrook. And you can call 362-2550 to get more information. You have that problem, do not be afraid. It's gambling. If you do your own research, and you will see a gambling addiction and a crack addiction almost have the same signs and symptoms. Similar. I got goosebumps the first time I saw that. But it is the truth. And I too, I'll give you all that story before we wrap up. But going to play with boots, and know a thing I'm doing, but I doing my own research and seeing how many people frequent playway outlets 4 times a day. Some
correct.
stand there for like half day because
Just
there's
like a
another
crack
game.
addict.
And there's another game that you can win every 2 minutes or something like that. And wow, it's really gripping. But there are people who fall out from this,
Yes.
who fall by the wayside.
Yes.
We here remember them and their families, because remember, as we say, it's not them alone going through it, their families as well feeling the pain.
Correct.
So please, for the sake of those, the gambling awareness initiatives that can be rolled out. Can we hear about that?
Well, responsible gambling messages and the funding of independent gambling support services. These are just a few of the measures that can be taken by these companies that run these games. But the catch is, Garth, that if these measures are genuinely designed to protect players and to reduce harm, then yes, they can be considered harm reduction. However, if they are just window dressing, minimal efforts to appear responsible while continuing to profit off of addictive behavior, then these measures will not be effective and cannot be considered harm reduction. So these are just 2 that we think can be implemented here in Trinidad and Tobago. There are several others, like setting deposit limits. So we allow players to self-impose limits on how much they spend. Self-exclusion programs where players can voluntarily ban themselves from playing. Reality checks to remind players how long they've been playing. And monitoring gambling behavior with AI technology. And intervening when signs of problem gambling appear. Those are just some of the other measures that can be taken by gambling companies in order to address the issues of problem gambling, to protect players and to reduce the harm that problem gambling causes.
Yes, and always remember, we've been as caring as possible. Let me just find, for want of a better word, people, we get the calls, We get the calls. We've been carrying this burden for the last 23 years. The burden of addiction with people who need help. And sometimes it's really difficult when we cannot go any further with the help that we can offer. We're just calling on these institutions to understand that there are people who get sick from the product that you sell, and their families get affected. Their homes that were broken up because of this, alcohol included. So this is not something that we're making up. It's just that we feel the pain. I saw my mother go through it. So that's where we're coming from, right?
So also, the other two things that we would like to see is a national school-based prevention program. We know that there are some organizations, NGOs, and state agencies that are doing this kind of intervention, but it needs to be on a national level, i.e. in all schools, regardless of prestige or not. And also peer-led outreach for rural and at-risk communities. And when I say peer-led, I mean by people like Garth Sinclair.
Putting substance abuse in the curriculum in schools.
Yes.
We have been asking for that since Mrs. Manning was the Minister of Education.
Correct.
That's to tell you how far back we suggested that. You know why? Because I saw the domino effect coming. It's just a pity that people like yours truly and others, I remember Deceased Wayne Chance. I'll never forget that. We try, we want to give that of ourselves that we don't. This is unselfish work, you know. I could have said, you know what, I good. Let me just go and see about my life and go on, you know. But this is deep work, and unless you've experienced it, you may never understand and have that much empathy for those who are experiencing it right now. But we have homes right now. This Easter Sunday, where a mother somewhere crying locked up in the bedroom, or a son harassing a mother for money, or a family.
Or she's sitting down waiting for the son she hasn't seen in 2 days to come back home.
Yeah, right now that's happening. You know, there are husbands who gamble all the money and disappear. And
for the weekend, and the family home wondering
yeah,
where he is and where the money is that he was supposed to bring.
Thinking that he could double up on what he has, you know. But
There you go.
I still hope that promise will be kept. And if the next government is serious about saving lives, this has to be a cornerstone of the agenda.
Absolutely. Because it requires a massive change in mindset.
Yes, it does.
Not just among the leaders, but amongst the society. From shame and punishment when it comes to addiction to support and healing.
There are people who speak about addiction or substance abuse. But do they really understand addiction? And from my experience, in the 23 years of doing this and my journey to where I am today, I could tell you not many people understand addiction. There's a big difference. And between just reading about it and experiencing it. I am just saying that there are a number of people like us who can help turn things around and not being allowed to. I could even go so far as to say, was Mr. Robert Ward from the Life Ministries or James Howard from the former chairman of the group on Arima Boys RC on a Saturday. You can go up there too. Maxwell now leads that group. Have they ever been put on a panel or National Drug Council and reached out them for advice? Because reading about drugs and actually experiencing it are two different things. I cannot, just yesterday again, another prison officer got caught with marijuana and cocaine.
Yep.
When I had the opportunity to speak to prison officers under Minister Hines when he was minister in the ministry, the prison officers meet me to this day and told me that they kept that in the front of their mind and they retired gracefully. Soldiers do the same thing. And I just wish that we would have more opportunity to save some lives. Because it's not just about substance abuse alone. It's about the domino effect. I paint that picture very good.